sure if I have the question, but well, actually I have two questions, so let me decide on which one I want to ask. One of the things that, in putting this all together, you know, if you say up to 50% of some populations of young adults don't have a job, most people aren't going to college. They're probably not as connected to their parents as they were. You're talking about an isolated person. And so if you have this isolated person, even if you have the best program sitting somewhere, how does that get to where they are? And how, you know, what is going on to try to bring programs into the community or infuse it so that those isolated people, which I would think would be a lot of the kids with mental health issues, do get some benefit? Oh, and my quick second question is about schizophrenia and the fact that in the past it's been misdiagnosed in certain cultures, like African Americans. What is the research on trying to infuse culture and figuring out diagnoses?
We'll start with the first question. So outreach, it is one of the key questions about how to get the treatment to young people. I think people are starting to think increasingly about how to encourage folks through social media. There are a lot of efforts underway to reduce stigma and to do outreach through, like the National Alliance on Mental Illness, NAMI, has a social networking website for young adults with mental health conditions. So that sort of mental health literacy as well, trying to raise awareness about what are early signs on college campuses and elsewhere. But I think in terms of treatment, trying to get people to treatment, when we have very high-risk groups, we have a clinical trial, which is home-based treatment. So you go to them. You might not go to them in their home because their parents might be there. They might want to meet at Dunkin' Donuts, but you go to wherever they want to go. So for a very high-risk group, you take the treatment to them. You don't take the risk of saying, oh, darn, I missed their appointment again. Oh, well, maybe they'll call back. The other thing that were little things, texting, if somebody has missed an appointment, to say, missed you, want to set something up. Seems, what I'm hearing from folks, we haven't seen any data on this, but we're finding that therapists are trying to figure out for themselves what to do. And so some elements of trying to stay in touch through texting, just minimally, because there are all these concerns about going too far into an issue, but just to kind of check in to say, will I be seeing you next week? I'm holding your spot open for you, let me know, type of thing, seems to make a difference. To get young people to recognize at the front end that what they're experiencing is a mental health condition, though, is the mental health literacy that we don't have yet in this country to a level that we really need to have. What is what is just being sad about an event versus something that's really reflecting a clinical depression? What is, being anxious about an event, again, reasonable anxiety versus a chronic condition that has to do with anxiety that is generalized to all kinds of things that is impairing your functioning. So we haven't done a very good job of getting mental health literacy out there. Plus we have the whole issue of stigma. And even though young people are much more willing to say that if you have a mental health condition, you should go get therapy, and they know a whole lot more people who have gotten therapy than people, say, in the 60-year-old cohort. There still is a real hesitancy. I hear people talk about college mental health. It's free. It's on campus. All you got to do is show up and you can get some, and you still can't get young people to come into it. So I think we don't know yet. I mean, it's one of the areas that we really need some research on, what gets them to treatment and what gets them to stay in treatment. It's a real basic question that we don't have an answer to. You guys have other thoughts?
I can just add one point on the first one and try and answer the second. I think screening items for a pediatrician or primary care provider with youth health may be the best way to reach the maximum number of people, at least through some organized care system, and we're trying to introduce that in Massachusetts. In terms of the second, misdiagnosis based on cultural or ethnic racial issues is a big problem. I think the best way to deal with that in general, it's a very complicated issue, is training of mental health professionals from a multicultural perspective. So it's a short answer to a tough issue, but I think that's the answer. And I see Claire probably wants us off, so.
Boy, we have a very important young adult panel we want to